We are looking at the GSD, that is the glycogen storage disorders. So type 1 includes the von Guericke's disease. So this is the enzyme defect of the G6P, that is a glucose 6 phosphatase. Then looking at the clinical features, it has the doll-like facies, that is a thin extremities, and there is a massive hepatomegaly. So looking at the biochemical markers, so it includes the hypoglycemia seen, there is hyperuricemia as well as hyperlipidemia. There is presence of the lactic acidosis as well as the ketosis. Next, looking at the type 2. Type 2 is known as the Pompey's disease. So here the enzyme defect is the acid alpha 1,6 glucosidase or the acid maltase. So clinical features, it includes the HCM and the cardiomegaly. There is presence of the extreme hypotonia, and there's mainly cardiac failure and the death by 2 years. Next, type 3 is the choris. Choris, also the limit dextrinosis. So here the enzyme defect is of the deep branching enzyme, and the clinical features, it includes there is no lactic acidosis, there is no hyperuricemia, the liver cirrhosis is present, and there's increase in the liver enzymes, that is the AST as well as the ALT. Then we look at the type 4. Type 4 is nothing but the Anderson as well as the amylopectinosis. So this then there's a branching enzyme defect, and looking at the clinical features, there is a abnormal glycogen, there is no lactic acidosis, there is no hyperuricemia, there is presence of the liver failure, and it can lead to the death of the child by 5 years. There is increase in liver enzymes in case of the Andersons, and that is the AST and the ALT. Then we look at the type 5, that is the McArdle's disease. So here there is the muscle is involved, MM. So the muscle glycogen phosphorylase, and the clinical features being there is a exercise intolerance, there is a second wind phenomenon, and the S-lactate, it decreases, and this is after the exercise. Now moving on to the 6th, that is the Her's disease. So HH, that is a hepatic glycogen phosphorylase. So here the clinical feature is that there is no severe hypoglycemia. Then we move on to type 7. Type 7 is the Torre's disease. So the enzyme defect is the muscle and the erythrocyte phosphofructokinase. So the clinical features, it includes there is exercise intolerance, presence of hemolysis, there is no second wind phenomenon, whereas the second wind phenomenon was seen in case of type 5, that is a McArdle's. And other thing to note in this type 7 Torre's disease, there is S-lactate is decreased, and this is after the exercise. Next we look at the Fanconi's Bickel syndrome. So here the enzyme defect is of the GLUT2, that is low affinity, Then there is something known as a type O. So here the enzyme defect is the glycogen synthase, and the clinical features is that there is no glycogen deposition as well as there is no hepatomegaly.